Hello and welcome back. I am Corinne, your friendly neighborhood science teacher, again to teach you all things pandemic. A reminder, I am not a doctor, so if you have any concerns, go see them. Thanks to everybody that did reach out about the other videos. I really appreciate it. So go back and watch that if you need background information about what this series is all about. As a reminder, all of the research that I've done has been cited in the video description if you need to do more research on your end. This week we've got 30 citations, so go check them out. And this week we do have Mallory. So she is my sister. She's been fixing up the recordings, so shout out to her. She's going to be asking the questions, and I will be teaching her and all of you at the same time. So anything you have to say?
Hello, I am Mallory, as Corinne said. I'm happy to be here. I had a lot of fun editing the last video, and I learned a lot in the process. So I'm happy to be here and learning in real time. So what are you going to be teaching us about today?
All right, so I'm excited for today. Today we are talking about masks. So this is my Fauci mask, I love it. So love them or hate them, they've been part of our lives for almost a year now. So we're gonna be talking about how to wear them properly, how they work, and a little bit of the science about the history of masks.
Okay, so I understand that masks are not new. So can you start by telling us a little bit about the history of mask usage?
Yes, so fun fact, I used to love history in high school, so I had fun with this part. So starting off back in the bubonic plague or the Great Plague or the Black Death is what it was called. So this occurred in the 1300s in Europe, Asia, and Northern Africa. And fun fact, 40 to 60% of the entire population died during this plague. So we all know of this as the plague doctor who had that bird mask with the big beak on it. And the purpose of this mask was to remove bad smells. And they really thought that that is how the plague was spread, by bad smells and bad air. So what they did is they put herbs and they put flowers inside this beak of the mask, and it would counter the quote unquote evil smells of the plague and prevent the doctors from being infected. Then next up in the 1880s, they discovered germ theory. So they figured out that germs are causing diseases. Surgeons started wearing gauze face coverings over their mouth to prevent germs from entering the wounds, to prevent infections from, operating in the surgery department. Next up, they had the Manchurian plague, which occurred in 1910 in Russia and China in Northeast Asia. And this plague had almost 100% mortality rate. So this was like a very bad time to be alive. Dr. Wu Liante proposed that this disease was spread through the air from humans to humans. And people thought he was crazy for this because before we thought that the diseases were just spread by rats and fleas. So this was kind of a new idea. And what he did, he invented an anti-plague mask. And everyone kind of scoffed at him. They said that he was crazy because, again, they said that people are not spreading diseases to other people. A French doctor, Dr. Gerald Mesny, don't know if I said that right, he denied wearing a mask. He worked in a plague hospital. He did not wear a mask. He got sick and he died. And that's when people decided, okay, wait, maybe masks do work. After this French doctor got sick and died, this led to a universal adoption of Wu's theory and its accompanying mask. And basically, almost everyone in the streets was seen to wear one form of mask or another. And while they knew about this for about a century, the wearing of face masks for protection against diseases didn't reach popularity into Asian countries until the 2002-2003 SARS epidemic. And then it was seen as putting on a face covering or a mask was seen as good citizenship. So basically it was like, I'm going to prevent you from getting sick, you're going to prevent me from getting sick. So it was seen as just general good culture. And then finally, the one that we kind of all generally know is the Spanish flu. So in 1918, it was worldwide. It was thought to have been spread in three big waves caused by the movement of troops during World War I. And interestingly enough, the mitigation measures were very similar to what we're doing now during the COVID-19 pandemic. It was said to just wear face masks, do social distancing, and confinement, stay in your home, stay away from people. During the 1918-1919 flu epidemic or pandemic, wearing a mask became mandatory for police force, medical workers, and residents in some US cities. And even then, it was seen as controversial. People did not like it. Specifically in San Francisco, they talk about this. There was a decline in deaths from the flu, and they attributed it to the mask wearing policies. Interestingly enough, in October of 1918, the San Francisco Chronicle ran a public service announcement telling readers that the man or woman or child who will not wear a mask now is a dangerous slacker. And that was a reference to a World War I slacker who didn't help with the war. They put up signs in California that threatened, wear a mask or go to jail. And then in general, masks have been used in medical settings since the 1920s.
And so what are the current regulations on mask wearing?
Okay. So currently there is a federal mask mandate. And what that says is that if you are on federal property, if you are at airports, if you are on a plane, a bus, or a train, you must wear a face cover. You must wear a mask. This does not have legal authority to implement a nationwide mask mandate that requires all Americans to wear a mask at all times. That is generally up to the state and local authorities to say, what are the mask requirements? Currently, 35 state governments require people to wear face coverings in public to help prevent the spread of COVID-19. The District of Columbia and Puerto Rico also have mask orders. And I did find that the AARP website actually has a very detailed listing of what are the exact mandates for your state. Some states that might not have a whole statewide mask order, they say that, it might be strongly encouraged, or it might be determined by the number of COVID cases for a certain county or a certain city, or individual cities might have their own government requirements. So check out the website, it's down below, and you can find out the specific details for your state.
Okay. So can you tell us who should wear a mask and when should they wear a mask?
Mm-hmm. So this is straight from the CDC. The CDC recommends that all healthy kids and adults wear a mask, except for children under the age of 2, or individuals that have trouble breathing, they are unconscious, incapacitated, or otherwise unable to remove the mask by themselves. You should be wearing a mask anytime you are in a public setting, so out and about, anytime you are traveling on a plane, a bus, a train, or other forms of public transport. If you are around someone who you do not live with, that includes inside your house or inside someone else's house. And if you are inside your own home and somebody that you live with is sick with COVID or who has tested positive for COVID-19.
Okay, so why should I wear a mask?
So masks have been shown to reduce viral transmission if they are worn correctly, so over your nose and over your mouth. Surgical masks and cloth coverings can reduce viral transmission by 70% if everyone wears them and wears them correctly, again, over your nose and over your mouth. And I actually have a picture that I'm going to show you. So here what we have, the highest risk of transmission is when neither person is wearing a mask. So if somebody has COVID-19 and a healthy person, so there is a high chance of transmission. Followed next by if a carrier, if you are sick, is not wearing a mask, but a healthy person is. So you can still get COVID-19, even if you are wearing a mask, but they are not. Next up, we have a low transmission probability. So if that person that has COVID-19 is wearing a mask, even if you are not, you are healthy, there is a lower chance of getting COVID-19. And then the lowest transmission probability is when the person with COVID-19, with or without knowing, is wearing a mask, and then the healthy person is also wearing a mask. So it's showing basically it does work if both people are wearing masks. They also prevent asymptomatic spread. So according to the CDC, about 50% of transmission of COVID happens before people develop any symptoms. So wearing a mask is an easy way to prevent the spread, even if you don't know that you have it yet. You're protecting other people from illness. Researchers show that mask wearing is most effective when it's a communal effort, so everyone should be wearing them. Another reason why you should wear them is they are mandated by law in some states, so it is the law, depending on where you are. In general, they're just good hygiene. Medical professions, so surgeons to dentists, they wear masks when they're in close proximity to working with germs and droplets and illness. In many cultures, wearing a mask when somebody is ill or if you have allergies is a sign of respect. So again, it's protecting yourself, it's protecting others from spreading disease. And also, the rates of flu in 2020 have decreased in the United States, Australia, Chile, and South Africa based on all of the preventative measures that people have had to prevent the spread of COVID. And then again, most importantly, masks alone will not prevent infection. They help, but with the other precautions. So social distancing, washing your hands. So make sure you're doing all of the above: masks and social distancing and wash your hands.
So if masks are so effective, how exactly do they work to help prevent the spread?
Okay, so I love this. There's this great New York Times infographic that they released last year at some point. I'm going to go through it. It is so fantastic. So the New York Times released this last October, and it's this great infographic that shows how masks work on the microscopic level. So we got lots of people, they're all wearing masks. So like it says, mask comes in a bunch of styles, bunch of materials, but generally they all do the same thing. So the layers of the fibers are going to capture those respiratory droplets and those airborne particles. So the things that are carrying coronavirus. And like you can see here, it is known as filtration. So it's basically filtering all of the things that are spreading coronavirus. So as we zoom in here, it's all about just all of these woven fabrics. So most of us are wearing cotton masks. Only the medical professionals are wearing those N95 masks. So we're going to go into the microscopic level. We're going deep down into the mask. So we are currently inside the mask. So these are the individual cotton fibers of your mask. So basically, this is what we're looking at. So the coronavirus itself is this smallest particle. So it's itty bitty, teeny tiny. But generally, it is carried by the larger particles because it's inside those aerosol droplets. Now, what's going to happen? So as you are breathing, they are going to go through the mask. So they're going in between the different particles. So they're traveling, traveling, traveling. The larger particles are going to be trapped by those fibers. So they're going to hit the cotton and they are going to be stopped. And you can see here that the smaller particles are still moving around, but they are going in a random zigzag pattern. So it's increasing the amount of time that is staying inside the mask. So it's allowing it to be trapped more often. So even though they're small, they still can get trapped because they're zigzagging around. And interestingly enough, the medium-sized particles are the hardest to filter. They are able to go in and out and in between. Now, keep in mind that the N95 masks are just for medical professionals. But what happens there is that they have an electrostatic charge. So what happens is that attracts the different particles. It doesn't matter what size it is, but they will all be attracted to the particles of the mask. So N95s are the best type of mask, and that's why they are exclusively for the medical professionals, because those are the ones that are working very closely with COVID patients.
Okay, so I know that you said that masks are effective, but if they are worn properly.
Mm-hmm.
So how do we wear them properly so that they can be as effective as possible?
Right. So you want to make sure that the mask that you are wearing is fitting properly. You want it to be snug around the nose and your chin. And you do not want it to have like gaping holes on the side. So I like these masks that have the little like attachments there, so that way you can tighten them. So you want to make sure as you put it on, it's snug at the nose, it's snug around the chin, it's tight on the sides, and you can tighten these little straps here. Generally, ones with a wire noseband, so you can tighten it around the nose, is encouraged because it keeps it as a tight fit. If you do have a cloth one, you want to have multiple layers. So you should be making sure that they have 2 to 3 layers, not just like a single kind of bandana layer. If you have a surgical mask, there's a really cool trick that the CDC put out. So you take your surgical mask, got one. All right, you fold it in half like this. So it's open, you fold it in half. And you want to tie a knot right at the base. So as close to the fabric as you can get. So it should look like that. Okay. And then what you're going to do is you're going to flip in, you're going to poke in the ends here. So instead of going out like this, you pop them so they're on the inside. So it should be kind of like a little boat. Oh, you have to get your other side. I already pre-tied my other side. So as you're doing that, you should have like a little boat shape on the inside.
Okay, I think I got it.
Okay, and then all you have to do is figure out where the top is. I have like a little noseband here. I like to put the straps on first. Ooh. And then pull it over your chin, over your nose. And you can see now there's no like gaping hole on the side. So it's tight, it covers the nose, it covers the mouth, it covers the chin. Everything's all trapped in there. There we go, easy peasy.
Wonderful.
It's important, especially in these winter months, that a scarf or a ski mask is not a substitute for your mask. You should wear your mask underneath those things. You can put them on top if you want to. A face shield by itself is not recommended at this time. So you can wear like the shield that goes down. You shouldn't be wearing just a face shield. You can wear that with a mask if you would like. And they actually have these masks with clear panels. So if you are somebody that's working with, young children that are learning to speak or to read, people that are hard of hearing, or people with disabilities, you can wear one of those masks so that the way they can see your mouth moving. And most importantly, please make sure that you are covering your nose. So you don't want to half cover your face. They actually did a study. In April, an international team of researchers determined that the nose is a key entry point of SARS-CoV-2, so the virus that causes COVID-19. They determined that the highest concentration of these proteins are located in your nose instead of deep in the lungs where they had thought that the proteins would be found. So generally, it gives you a false sense of protection. You are more likely to be infected and spreading this if you are half wearing your mask, because that's where all the receptors are. And make sure that you're washing your masks regularly. So if you wear a cloth one, you can just pop them in the washing machine, or you can hand wash them. You want to make sure that you're not contaminating your surfaces. So if you get, virus or bacteria on your masks, you don't want to be breathing that in. You don't want that on the surfaces of your home.
Okay, so we know that masks are important for minimizing the spread. So why did they say at first that we didn't have to wear them. And now they're saying that we should be wearing them.
Mm-hmm. So I remember it was almost a year ago when this started, coming about and it started getting big in the United States. They said, don't wear a mask. And then they said, you only have to wear a mask if you're sick. And then they said, everyone has to wear a mask at all the time. So it was confusing and conflicting information. So the original CDC guidance that said you don't have to wear a mask is based on what they thought was a low disease prevalence earlier in the pandemic, when it wasn't as big in the United States as it was. So in the early days of the pandemic, the World Health Organization and the Centers for Disease Control, they said, don't use masks. They said that masks won't protect people against getting the disease. And they said, don't use masks because we're going to be taking them away from healthcare workers. I always think like toilet paper, like they were used up immediately at the beginning of the pandemic. So they said, don't wear masks because medical professionals need to wear them. However, as the weeks went on, they got more and more evidence. They started to learn. They learned that the virus spreads through the exhalations of people that are sick. So they are sick, they are breathing it out. And that happened whether or not they knew that they were sick. So basically, they figured out that anybody could be a source of transmission. So anybody could be spreading it. But as the weeks went on, evidence began to accumulate, scientists began to learn more, and they realized that the virus is spreading through the exhalations of infected people. So infected people are breathing out the virus, whether or not they know they're sick. So basically anybody could be a source of transmission. And they realized that, you know what, instead of you wearing a mask to protect yourself from getting sick, it's more you need to wear a mask from getting other people sick. So by April, May, and June, studies began to accumulate that showed that wearing masks does prevent the viral spread when you wear them correctly. And that has been the narrative ever since. And really, that's what happens with science. You learn things, you can be wrong. Once you get it right, you say, we're right now.
All right. And how would you respond to the rumor that masks cause a buildup of carbon dioxide?
Okay, so false. Face masks do not decrease your oxygen intake. They do not make you retain any more CO2. Oxygen and CO2 molecules are very, 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 very small. They can pass through any type of mask that you are wearing. So if you are wearing a properly fitted mask, you have adequate airflow, it will allow oxygen to come in, CO2 to come out. It is impossible for carbon dioxide to be built up when wearing a mask. The droplets, which are carrying the coronavirus, are much bigger, and that is what's being prevented from escaping when you're wearing a mask. And really, wearing a face mask now is what's going to help us get out of this a lot sooner.
Okay, so do I need to wear a mask while exercising outside?
Really, it depends on where you're at. So in general, if you're going to be in a crowded place like a park or a running trail or where there's a lot of people and it's hard to maintain social distancing, you should be wearing a mask. Because again, if you're around other people, if you are within 6 feet, you can spread it to them. They can spread it to you. If you are running around outside in your neighborhood and you might occasionally see another person, you should be fine. You can just cross the street. As long as you are able to stay 6 feet away from other people, you should be fine. Just think about where are you going to be. Doctors have said a face mask is going to decrease your airflow, making it a little bit harder to breathe if you are running. Again, it will not decrease your oxygen intake or retain carbon dioxide. It's probably going to impact your performance a little bit, but it is totally safe to wear a mask while running. Again, they have done exercise studies that showed that your heart rate, your respiratory rate, your blood pressure, your oxygen level, and time of exhaustion are not significantly affected by wearing a mask during moderate to strenuous aerobic physical activity. So it's totally safe to wear a mask while you're exercising.
Should I ever be wearing two masks?
Okay, so this is kind of like the new studies, the new research. On February 10th, the CDC did a study. They released the research that showed that wearing cloth face mask coverings over a surgical mask. So wearing those 2 layers, as well as tying knots at the ear loops and securing it, does offer greater protection against COVID-19 than just wearing a fabric covering or a poorly fitted medical mask alone. So just like the infographic showed, by adding that second mask, you're just adding more layers for those droplets to be caught in. So it's just increasing the chance that, something is not going to be coming in or something is not going to be going out. They say that it's best to be used in a high traffic area. So the grocery store, public transportation, or other high traffic area. So other high risk settings like hospitals or nursing homes. But it's important to note that the experts say wearing any mask is better than wearing no mask at all. So if you don't have 2 masks, it's not the end of the world. Don't stress. Still wear your 1 mask. You're still going to be protected.
So why don't people wear masks still?
So there's 4 main reasons why people still might not be wearing a mask. So first of all, we have these competing messages. Like we said, they said don't wear it and then do wear it. So messages are going to lose their credibility if you have a bunch of different sources that are saying a bunch of different things. Another one is denial. It's a strong motivator. If you are saying, you know what, I want this COVID thing to be over, if you just say like psychologically, like, oh, it's not that bad, or no, it doesn't matter, like you might not want to wear a mask. The third thing is not wearing a mask puts that person in control. So this is a time where we don't have a lot of control in our lives. So by you deciding I'm not going to wear a mask, that is allowing you to have control of your setting. And then finally, some people just refuse to be a team player. We've all been in a group project before where some people just don't do the work. And there's just some people that are saying, no, I don't want to do it. Even though they might know like it works, they say, just not feeling it. So that is the story about masks, why you should wear them, how you should wear them. They've been around for a very long time. So stay tuned for next week. We're going to talk about vaccine history, how vaccines work, and then we're going to really get into the nitty gritty of the COVID vaccines, which again, I'm super excited to talk about. So thank you all for being here. Thank you for being here, for asking these questions. And
Thank you for teaching me.
of course. So we'll see y'all next week.
All right. Bye.
Bye.